I appreciate Senator Alexander's kindness in allowing me to say a few words in support of this bill on behalf of myself and Senator Murray. I'd like to congratulate Senator Alexander for once again showing how the Senate can work properly, how we can bring together Republicans and Democrats between a priority that really has nothing to do with whether you're a Republican or a Democrat, whether you voted for Hillary Clinton or Donald Trump. If you're out there suffering from a life-altering or potentially terminal disease, if you're out there suffering from mental illness or addiction, you need help. And we are coming together in maybe one of the most important pieces of health legislation that has passed this Congress in a very long time to deliver that help. So I am not going to endeavor to recreate the remarks of Senator Alexander when it comes to describing the important aspects of this bill, except to say that after passage of this bill, it is just going to be a whole heck of a lot more likely that a life-changing, life-saving drug is going to be able to make it to market in time to save a life. And every single one of the underlying reforms in this bill to the drug discovery process is bipartisan. Think about Senator Bennett's and Hatch's bill, the Promise for Antibiotics and Therapeutics for Health, which establishes a new pathway for antibacterial and antifungal drugs that'll treat serious life-threatening infections for patients. I think about Senator Casey and Senator Isaacson working on the Advancing Hope Act, which is going to extend the pediatric priority review voucher program until 2020. It incentivizes drug companies to research treatment for life-altering diseases that impact pediatric patients. Inside this bill are all sorts of good, important, bipartisan achievements. As Senator Alexander noted, there's also help on the way for people suffering from addiction. The fact of the matter is, in my tiny little state, only 1% of the nation's population, we're going to have over 800 people die this year from drug overdoses. And yeah, we need to get to the source of that epidemic, stop people from getting addicted to pain medications in the first place. But boy, we have an awful lot of people that are showing up with overdoses in our emergency rooms that have no place to go, that have no detox programs, that have no long-term residential programs. This $1 billion that's authorized in this legislation to fight the opioid epidemic, that's going to save lives in my little state. And finally, when it comes to the issue of mental health, Senator Alexander and Senator Cassidy and myself were on the floor last week talking about this legislation. The focus on funding prevention, the focus on making sure that parents are part of the care for their adult children, the focus on ensuring that insurance companies really do pay attention to the Parity Act that we passed 10 years ago in this Congress to assure that you get covered for mental illness, just like you get covered for physical illness. A broken leg, really isn't any different than a broken bone when you think of a broken brain. When you think about it, we can treat both. These are really important advances in mental health as well. I know that this place, has a bad reputation, that people pay attention to the fights here more often than they do to the moments where we get together and cooperate. But the 21st Century Cures Act that Senator Murray and Senator Alexander, with help from Senator Cornyn, myself, Senator Cassidy in the House, Congressman Upton and Pallone, and Tim Murphy and Eddie Bernice Johnson, this is an example of how this place can work better. And as we head into, what may be a very charged atmosphere in January, I hope that we remember this moment. And I wanted to come down on behalf of Senator Murray, who's helped shepherd this through the process, and congratulate Senator Alexander on it and recommend its passage to all of my colleagues.